Ouch, that stinging, burning pain in your mouth that just won't go away. We've all been there, right? That tiny little sore that feels like a volcano erupting every time you try to eat or talk. Yes, I'm talking about the dreaded mouth ulcer. They might be small, but boy do they pack a punch. You're trying to enjoy your favorite spicy dish, and suddenly zap piece, instant regret. Or you're in the middle of a presentation, and it feels like there's a tiny fire inside your cheek. So annoying. But what exactly are these painful little spots, and why do they seem to pop up at the worst possible times? Well, don't worry, because today we're going to dive deep into the world of mouth ulcers, also known as canker sores. We'll uncover what causes them, how to get some sweet relief, and most importantly, how to prevent them from crashing your party in the first place. Stick around, because by the end of this video, you'll be armed with all the knowledge you need to fight back against these pesky intruders. First off, let's get one thing straight. Mouth ulcers are super common and usually not a big deal. They're basically small, painful lesions that develop in your mouth or at the base of your gums. Unlike cold sores, they aren't contagious, so you can't pass them on to anyone. They just show up, uninvited, and make life a little miserable for a week or two. So, what's the trigger? The truth is, it can be a bunch of different things. For many of us, it's minor injuries. Ever accidentally bite your cheek? Yep, that can do it. Brushing your teeth too aggressively or even a sharp piece of food can cause enough trauma to start an ulcer. Sometimes, it's about what you eat. Foods that are very acidic, like citrus fruits and pineapples, or spicy foods can trigger them or make existing ones worse. Even certain food sensitivities too, things like chocolate, coffee, or nuts can be the culprit. But wait, there's more. Stress and lack of sleep are huge factors. Notice how they always seem to appear during exam week or a stressful period at work. That's no coincidence. Your body's immune system gets a little out of whack, and bam, mouth ulcer. Hormonal changes, especially for women during their monthly cycle, can also play a role. And in some cases, a deficiency in vitamins like B12, zinc, or iron could be the underlying issue. It's like a perfect storm of potential causes. Okay, so you've got one. Now what? The main goal is to soothe the pain and help it heal faster. The good news is, most ulcers go away on their own in about 1 to 2 weeks. But who has time to wait? For some quick relief, you can try an over-the-counter topical anesthetic gel or paste. These create a protective barrier over the sore and numb the area, which is a lifesaver before meals. Another classic home remedy is a saltwater rinse. Just dissolve half a teaspoon of salt in a glass of warm water. Swish it around your mouth for about 30 seconds and spit it out. It helps clean the area and can reduce inflammation. To avoid making things worse, try to stick to soft, bland foods. Think yogurt, mashed potatoes, and smoothies. Steer clear of anything crunchy, spicy, or acidic until it's healed, and be gentle when you brush your teeth. Use a soft bristled toothbrush and try to avoid poking the ulcer. Now for the best part, prevention. How do we stop these things from coming back? A lot of it comes down to lifestyle. Managing your stress is key. Whether it's through exercise, meditation, or just getting enough sleep, a calmer mind can lead to a calmer mouth. Pay attention to your diet, too. If you notice ulcers pop up after eating certain foods, try keeping a food diary to pinpoint your triggers. And of course, maintaining good oral hygiene is crucial. Brushing and flossing regularly keeps your mouth clean and free from bacteria that could complicate things. If you suspect a vitamin deficiency, it's a good idea to chat with your doctor. While most mouth ulcers are harmless, there are times you should see a doctor or a dentist. If you have an ulcer that's unusually large, lasts for more than 3 weeks, is completely painless, or if you keep getting new ones before the old ones heal, it's best to get it checked out. It's always better to be safe and get a professional opinion. So there you have it, the complete guide to understanding, treating, and preventing mouth ulcers. There may be a pain, but with these tips, you can take control and get back to enjoying your life and your food, pain-free. I hope you found this video helpful. If you did, give it a big thumbs up. And don't forget to subscribe for more health and wellness tips. Have you got any go-to remedies for mouth ulcers? Share them in the comments below. I'd love to read them. Thanks for watching, and I'll see you in the next one.